of Asian American children and families. And on behalf of CACF and our 15% and Growing campaign, I want to thank you all for taking the time to be here today for our first ever virtual teach-in on COVID-19 and its impact on the APA community. This virtual teach-in is a part of our 13th annual and first ever virtual APA City Advocacy Week, which is a week-long series of action under our 50% and Growing budget equity campaign that brings together over 45 Asian-led and serving organizations across New York City to fight for a fair, equitable, and inclusive New York City budget that protects the needs of all APA New Yorkers and also the diverse and dynamic organizations that support them. I'm now going to turn it over to Stella Yee, our partner from NYU Center for the Study of Asian American Health, to share a data presentation on COVID-19 and some of the challenges surrounding the pandemic and our APA communities.
Great, thank you, Lakshmi. Let me pull up my slides and share my screen. Just give me a minute. Okay, look good? All right. Sorry, just a minute. All right. Okay. All right. Hi, good afternoon, everyone, and thanks for the opportunity to present our perspective on COVID-19 and Asian American communities. So as we all know, COVID-19 disproportionately affects all people of color, not just Black and Latinx populations, but Asian Americans, Native Hawaiians, and Pacific Islanders as well. An analysis of over 50 million patients in the Kaiser Family Foundation data demonstrated that Black, Hispanic, and Asian patients had significantly higher rates of hospitalization and death compared to their white counterparts. Here's another article that was released in November of 2020, a systematic review of 18 million patients across 50 published studies demonstrating that Blacks and Asians are at higher risk of COVID-19 infection compared to whites. Despite this evidence, national COVID-19 efforts have not included Asian Americans. These are two such examples. So on September 30th, the NIH announced their commitment of investing $234 million to fight the disproportionate impact of COVID on communities of color, which you can see does not include Asian Americans. Around the same time, the National Academies of Science, Engineering, and Medicine announced their framework for equitable allocation of vaccines, which similarly does not include Asian Americans in its priority list of minority groups. We and other experts across the country, however, believe that the COVID-19 picture for Asian Americans is incomplete. We think that this is for three reasons, which I'll walk through briefly. First, number one, is data quality on Asian Americans is poor. So for example, at the national level, as of February 18th, 2021, race ethnicity data were missing for 49% of cases, 26% of deaths, and about half of vaccinations. And here in New York City, race ethnicity data is missing for 59% of cases, 23% of hospitalizations, 10% of deaths, and 30% of vaccinations. This is especially problematic for Asian Americans because first, Asian Americans and Hispanics are more likely to be classified as other or missing in hospital discharge data. And second, there is a broader movement in the sociological literature that only East Asians count as Asian American. Both of these factors may be contributing to an underestimate of the COVID-19 burden among Asian Americans in New York City. Since the start of the pandemic in March 2020, we have actually learned more about the Asian American COVID experience from our community partners, social and mass media, and other countries, for example, the United Kingdom, than from the published scientific literature base in the United States. Efforts to understand the COVID-19 burden among Asian Americans is further limited because there is a lack of data disaggregated by Asian subgroup. These concerns led us to work with colleagues at the New York City Health and Hospitals Corporation, where we examined roughly 85,000 patients that had been tested for COVID between March and May. In this analysis, we applied surname matching to classify misclassified Asian Americans, which nearly doubled the sample size of Asian Americans, and allowed us to characterize specific Asian American groups, including Chinese, South Asian, and other Asians, which included Filipinos. What we found was that South Asians, which are in blue, had high rates of positivity and hospitalization due to COVID, and Chinese Americans, which are in red, had the highest mortality of all racial ethnic groups, disparities that were not observed in the aggregated Asian group. The third reason why we feel the COVID-19 picture for Asian Americans is incomplete is because, as many of us on this call know, Asian Americans are not routinely counted as a community of color experiencing disparities. So it's really all three of these factors that were happening pre-COVID, but have only been exacerbated, like many things during COVID. In an effort to address these deficits in data that are being recognized at the national level, since June of 2020, we at NYU CISA have been working on our Forging Partnerships project in partnership with the Asian Pacific Islander American Health Forum and 6 other coalition groups, including CACF and 20 New York City area organizations, some of whom you will hear from later today. Our project is driven by a set of coordinated activities around data. The starting point for our work is direct community input, which we receive from community partners, our community health workers, and community members themselves. This input is anchored by 8 community-based primary data collection efforts that use the same questions across surveys, secondary data analyses of 6 local, state, and national data resources, and coordination with 15 additional data collection and collaborative efforts. These activities equate to 360 organizations and 65 individuals across the country. Lastly, we actively track all of the published scientific literature, social media, and news on COVID-19 and Asian Americans, Native Hawaiians, and Pacific Islanders. Findings from these efforts are being shared directly with the CDC to inform the national COVID response, and we can certainly share with all of you to help inform the local response as well. I'm just sharing here very briefly an example of some of this work. Through multiple sources, we have pieced together this information from the published literature, news media, and social media about how the different Asian American subgroups are experiencing the COVID-19 pandemic, and have compiled them into a succinct resource, again, that we are very happy to share. I'll just close with this recent quote from an article on COVID in the Washington Post. Public health experts say that good data is the cornerstone of an effective pandemic response. Without it, health officials and others fly blind. Thank you for your time, and I look forward to answering any questions.
Thank you, Stella, and thank you, CISA, for all your partnership and the work that we're doing together to uncover what's going on during this pandemic. And thank you all for joining us today for today's teach-in. Today we have representatives from city and state elected offices, press, community organizations, and community leaders and members. So as Stella just did lay out a wonderful job of providing us with, a backdrop, highlighting some of the data we have on our communities at this time, but also showing us that there are a lot of holes in the data right now. There's a lot that we don't know. Our diverse Asian American communities cannot be erased from the conversations around the pandemic. Even prior to the pandemic, many of our communities struggled with high levels of poverty, language barriers, isolation, mental health issues, and other challenges. You'll hear today about how this pandemic exacerbates our struggles and the inequities our Asian American communities face in accessing vital supports. And you'll learn about the community leadership and the strength that has shown through this pandemic, and the critical role of culturally responsive and language accessible services, which are the most effective in addressing the needs of our very diverse communities. I'm sorry if I didn't introduce myself. My name is Anita Gundana. I'm co-executive director of CACF. And I just, speaking of diversity of our communities, and before I pass it along to Vanessa Leung, I would love to have us take a couple of group shots of this amazing and diverse community that are gathered here today. So if you have your cameras off, this is the time to just keep them on for a couple of minutes as we scroll through our Zoom screens. And I will give it to Andrea and Denise from our CACF team to lead us through some group shots.
Hi everyone, so we're just waiting for a few more folks to turn on your video so we can include you in the shot. And then I'm gonna count down. All right, here we go. 3, 2, 1, smile.
And keep smiling.
Okay, thank you everyone.
Thanks, folks. All right, and I will pass it along to Vanessa Leung.
Thanks, everyone. And thank you so much for joining us. I'm Vanessa Leung, Co-Executive Director of CACF. I really want to actually thank the amazing group of speakers. We have leaders from our community organization representing really the diversity across our Asian American New Yorkers. And there are so many more organizations that you'll hear from today that continuously to work tirelessly to serve and lift our communities in so many ways during this pandemic. I'm just going to quickly introduce who we have this afternoon. So we have Anetta Citrin from Chaya CDC, Chaya Chum from Mekong NYC, Dia Basusen from Sapna NYC, Hong Xing Lee from CMP, Jihei Fisher from the Korean American Family Service Center, Sudha Acharya from SACS, the South Asian Council for Social Services, and Wayne Ho from the Chinese American Planning Council, CPC. So we'll be starting off with a facilitated dialogue with our wonderful speakers, and then there'll be a time for Q&A after that. But throughout our time together, please encourage you to drop your questions in the chat. That includes questions for Stella from CISA. We'll keep that, we'll monitor that, and we'll try to elevate those questions as we move along. So I wanted to kind of just first start off, I think, we understand the immense challenges that are facing New Yorkers, but often particularly things that have remained invisible within the Asian American community. So let's start off with, if anyone wanted to share about what you've seen as some of the most challenging issues to address in our community during this pandemic. And you all could unmute yourselves. I don't know, whoever blinks first will be called upon. Just kidding. Okay, Wayne, you smiled. Tag, you're it.
All right. So good morning, good to see, or good afternoon, good to see everybody. So Wayne Ho with the Chinese American Planning Council, CPC. We're the largest Asian American social services nonprofit in the country. I think the biggest hit that we've seen in the Asian American community is that we need to remember that with the former president, with where the virus is believed to have started, that Asian American neighborhoods were hit over 2 months before the rest of New York State went on pause. And because of that, we knew that our businesses, our community members, our family members were all impacted 2 months before others were. So that's everything from lost business, lost income. In a survey that CPC did with parents that we serve, about 70% said that they lost job hours, they lost employment, they could not make ends meet. And these are stories that we hear across the board in all our programs, not just our parents. So I think one of the other things we need to remember is that Asian Americans are frontline workers. From the ones that get a lot of media attention in terms of nurses, doctors, as well as grocers and deliverers. We're also human services workers who were contractually obligated by the city and state to continue providing services. And what we need from the city and the state is make sure that there is hazard pay for all of our workers who are putting their health and their family's health on the line. We need to make sure that there's a continuous access to the vaccine. We need to make sure that everyone who wants to be vaccinated can get it in a language of their choice. And that's where it's important at this time that our state allies understand that we need true vaccine equity for the Asian American community in all the different languages and ethnicities that we know. There should be money going towards navigator programs, so CBOs like us can do navigation on behalf of our communities. And then for the city council, we need to make sure that the city council is investing in not just senior programs and citywide initiatives, as opposed to cutting citywide initiatives right now. They should also invest in initiatives like the Communities of Color Nonprofit Stabilization Fund, because it's going to be our organizations that are going to help with recovery as well as relief.
Wayne, you spoke about equity, right? As far as the vaccine is concerned, or even actually recognizing that Asian Americans are really suffering. We know that they've lost jobs. Because of jobs, they've lost their health insurance, and some of them have lost homes, and some of them have moved to shelters. And more than anything, the food part of it, people are hungry. I can't believe in New York, in 2021, people are going hungry. This is, okay, I'm Sudha Acharya from the South Asian Council for Social Services, or SACS. We've had to transform the way we serve people, the most vulnerable of them, delivering groceries to their homes, and then cooked meals for those people who can't even cook. These are patients. We already heard how many are affected, how many are patients, and when they come out of the hospital, they can't cook. So thousands of them are going hungry. I think amongst all these other things that are really worrying them, I think hunger probably is the most acute. Yeah.
Well, thank you, Wayne, for really pointing out too that there's a number of us in community organizations who are frontline workers, a number of our community who are frontline workers, and so that for really kind of driving home the idea of food insecurity and how hunger has just pervaded our communities. I'm wondering if folks on the panel can also chime in around just what are the critical services that your organization has really been focused on. I know, Sudha, you just mentioned food pantry, but to meet those exacerbating.
I'll tell you, but then I'm sorry to jump in again. I'll tell you the numbers will really surprise you. It's gone up by 300%, right?
Oh,
like our curbside pantries, it's 50% East Asian, Chinese, and Korean, and we have African Americans, Hispanic Americans, of course, South Asians as well. But the thing is, what worries me, Wayne brought it up, we are not considered, our pantry workers are not considered essential workers. We haven't gotten them vaccine yet. That's what worries me. Why don't they recognize that, even if they bring it up again and again?
Yeah, we've seen such an increase, and appreciate that SACS is one of the very few culturally responsive food pantries in the city to serve kind of the diverse Asian American community. I apologize, I actually failed to recognize Linda Lee from Korean Community Services of Metropolitan New York. So I wanted to ask Linda if you could chime in about what you're seeing with your seniors, as well as, you have one of the only mental health clinics that are serving our population.
Yeah, so we've been seeing, well, I mean, this is something that all of us, I think, have been experiencing, is that on top of a lot of the challenges in trying to serve the community, a lot of our communities have very specific language needs, and something that we found out right away is we had to pivot our services very quickly, because a lot of folks in the community were contacting us and asking, can you help us sign up for unemployment benefits, right? And that's not something we usually do, but people were losing their jobs left and right. And if you go online and try to do that, it's only in English. And also, if you don't know how to use technology or, computers, or don't have access to that, it's really difficult to sign up for those benefits. And then also you have to recertify those claims on a weekly basis, right? So it's not just like a one-time thing, but you have to recertify it every week. So we were trying to sign up for the clients initially one by one. Like, we literally had to just make appointments, have our staff sit with glass walls in between, and just try to assist people one by one. And then just also teach them slowly how they could do it on their own. And I'm sure a lot of other folks on this call had to do the same as well. And when you talk about loss of health insurance benefits, also because of loss of employment, then how do you seek services like mental health and other supportive social services that usually would be covered by insurance? And so I think there's multiple layers of challenges that we've been seeing in the community, but thankfully, we do fee-for-service sliding scale, and if clients do need to seek help for mental health services, we won't turn anyone away. And thankfully, we were able to get some emergency funds for an angel fund to cover some of those costs, which is great. But the challenge with mental health is the huge stigma that was already there. and plus, you know, the stigma that's there, as well as the lack of in-language services, and to be able to provide therapy in a culturally sensitive way. And it was challenging before, and with the increase in demand, as well as, you know, amongst the seniors, as well as individuals in the community, it's been tough on both the staff as well as you know, as well as the clients, obviously. And so, and to be honest, there's just not enough bilingual social workers and mental health professionals out there that do and are able to speak the language. And so that's the other challenge as well on the flip side. But, you know, thankfully, you know, we have been able to address the wait lines for the clinic. We've been, you know, hiring up actually, and we have found some pretty great social workers recently. And so, yeah, but it's been quite the challenge, and we're trying to see how we can partner as best as possible with different staff, senior center staff, public health staff, to sort of address all these issues at once.
No, you
So
brought about staff. Oh, you brought about staff and trauma. I mean, Chaya, you've talked a lot about trauma compounding upon the trauma of that pandemic, and particularly what's been happening in your communities in the Bronx.
Yeah, and you know, it's pretty obvious. I think Wayne laid it out pretty well around just like we're pretty much essential until we're no longer essential. And so, and that's sort of the reality of even on the state of our mental health, right? And so, like for my community, even before the pandemic, so Chaya Chow, director of Mekong NYC, we're based in the Bronx, and we work and organize with the Southeast Asian community, particularly the Vietnamese and Cambodian immigrants and refugee communities. And so, I mean, pre-pandemic, we had over 50% of our community members living in depression, over 70% with PTSD, you know, because of the genocide and the war in Southeast Asia. Those things sort of carried its way into our everyday living. And we know the failures of the refugee resettlement program very well. And that included this data that I just shared with you was taken 30 years after our resettlement. And so just to emphasize, like, I wonder how many more years it's going to take to really share the data of what's happening now in this pandemic. And so Stella, we would definitely be working with each other even more to do that. And it's sad that I know that this is not going to show up until anytime soon, if it's not for us to be able to do it ourselves. So the staff have become, you know, healers, organizer, mental health workers, organizer. I mean, planning funerals. You know, for us, like the rituals of funerals are so important, right? And like that was completely lost. The ways in which our people mourn and grief, and so I can imagine that those things are still being carried, and things that are re-triggered, you know, from the genocide, where people couldn't mourn their lost loved ones, you know. And so this really showed for us like the ways in which like irresponsible governing, you know, and a failed policy continue to exacerbate the mental health needs of our community. And so we also saw there was a rise in gender-based violence at home. We always knew that these things existed. And so, and honestly, increase in detention, deportation, like the increase almost 300% in the Cambodian Vietnamese community. And so as we were fighting to keep family home, fighting to feed people, to give people care packages, a lot of our folks are nail salon workers, a lot of folks worked in the hotel industries, in sex work industry. All that stuff has been created a chaos in the community that, you know, I didn't see, that I saw in the beginning of our resettlement program. And so we're at the state where we were 20, 30 years ago when we resettled into the United States after the war in Southeast Asia. And so, and I think for us, one of the things that's one of the most challenging aspect of all this is that we don't have enough mental health workers who speaks Vietnamese or Cambodian. We don't have enough social workers. To Linda's point, you know, there just isn't enough folks in our community. And so the culture healers, the workers, the monks, we have to rely on our culture to be able to hold each other, which we have for a very long time as part of our resiliency practices. And one of the scariest thing when we started collecting surveys, we did so much one-on-one. It was pretty exhausting for our staff. And so I think about like how my staff had to get ready, and myself, we have like kids remote working, remote learning and all that stuff. And so particularly for women, our work in the households is, men continue to be mediocre in those ways, and so so is the government, and so we've always been at the front line of this, and we've always have to see our community come through. And the saddest thing, I think one of the most horrible thing I've seen was a community member who had PTSD, just got diagnosed a couple years ago, had COVID, but didn't want to go to the hospital because he didn't want to die. And so for people to make that kind of decision, and the way like he described him and his family going through COVID was just crazy, because, for them to choose not to go because they know that no one could speak their language, no one could feed them the kanji that they wanted, no one could give them the medicine that they wanted. They just didn't trust like an institution that's supposed to keep you safe and healthy to keep you alive. And that's a problem. And so, my family, like the other thing, and the last thing I'll say is this, which is that our community live in multi-generational households. So I live in the household, first floor is my mom. And so my family had COVID, and so we had 5 households, 15 family member COVID all at once. And I can share with you the whole horrible story of how these trace and test and trace failed us tremendously. And I became the sole provider and monitor of my family. And so, and that's just unacceptable. And I'll say it, and then that's the last thing I'll say, which is that it has been, but we knew that we knew that we're gonna have to show up for our people, and not the government. And people, when like, the disappointment is gone, the anger is here. And so I hope that as we share our stories, the other stuff that we're not collecting in terms of why people didn't go to the hospital is something that we continue to collect and share and talk about. And so, yeah, so I'll end it with that.
Thank you, Chaya. And you have a community here and we want to support you. Anata, I wanted to just pivot to you because Chaya mentioned a bit about these multi-generational homes and homes, given the work that Chaya CDC does, what you're seeing in communities around housing, and also kind of the small landowners and landlords landlords and small businesses impacting, particularly in your key area, Jackson Heights.
Yeah, thank you. Thank you. Hello, everybody. Aneta Sicharan, Chaya Community Development Corporation based in Jackson Heights. However, we serve New York City. We serve folks from across the city. I just want to pick up on something that that Chaya just said that really reminded me of what it felt like and what it continues to feel like for those of us who are running organizations that are small, that are the only ones of its kind in our communities, when the scale and the complexity of the need is so great. It has felt like the burden is just too great. Like Chaya, we are a housing and economic justice organization, but we pivoted. We did food pantries, cash distribution, unemployment assistance, our tenant work, went beyond what we typically did, beyond the typical tenant organizing, helping folks apply for the very limited, highly inaccessible rent relief that was available at the state level. Scaling up our first-time home buyer program and our post-purchase, which is program, which is
in recent years have not been primarily around foreclosure, but all of a sudden pivoting it to become like foreclosure prevention, because so many of our community members were signing up for loans that had a balloon payment 90 days, later, and didn't know what they were signing. And then, of course, the sort of language inaccessibility piece of at every turn, every place, right? Whether it was like, as Linda mentioned, navigating the unemployment system, or navigating the rent relief. And then also it felt like the only help available were really truly only available for those who could access technology, right? Like, so there was like the digital divide that came into play. And I would say, all told, as I think so many have said, and we all recognize, that the pandemic in the most powerful way surfaced all of the preconditions that we had all been working to eradicate for so long. But it like overnight really amplified everything, and made it at times, I think, particularly unbearable for our communities. Specifically on housing, I mean, it's no secret, we are seeing a crisis unfold every day. Everything starts with housing. All of the well-being starts with housing. If you don't feel safe, if you don't have a roof over your head, it's hard to imagine anything else. It's hard to thrive, really, right? The reason why we haven't seen more people on the streets who've lost their homes is because of the moratorium. However, that is not going to last forever, right? And there is no meaningful relief that is large enough that is coming down the pike to address the rental arrears, which is now over $1 billion in New York City. And then, of course, there's the mortgage side, which ties to, I think in the early days of the pandemic, folks were like, cancel rent, cancel rent, cancel rent. But so many of our community members actually rely on the rent in their, small 2-family or 4-family unit as their only source of income, or the way in which they're able to afford their mortgage. So there was the other side of the ledger in terms of this whole, calculus in cancel rent. And so, Chai had to really step up our advocacy and our sort of reframing of the whole picture of what is really needed. And so we are anticipating a massive crisis of foreclosure facing our communities, without, again, no meaningful plan in sight of how that is going to be addressed. And it is truly going to be catastrophic. And I think, some of my colleagues have already mentioned the pressure that places on organizations like ours that are, as I mentioned, like already like overburdened, right? Our survival in all of this is going to be critical, because we know that we were the only ones there for our community, advocating on numerous issues.
Thanks.
So I just want to close by underscoring the need for the survival of the group of organizations that are participating in this, in this teach-in today.
We're hearing, sustaining you all is so vital, because you're ultimately sometimes the only lifeline for so many New Yorkers every day. Hong has, from CMP, you had some really interesting data around some of the small businesses you work with, and the impact you've seen around job loss and kind of the need for continued workforce development and job placements.
Yes, this is Hong Lee from CMP Chinatown Manpower Project. We are a workforce and economic development organization. Just to share with you two case examples. Well, two experience. One is right at the beginning of the pandemic when New York City first shut down. We actually were planning a job fair at the end of March. And usually our job fair had about like 500, 400, 500 job seekers and about 30, maybe 35 employers. And with the pandemic, we actually continued with the job fair, but we turned it into a virtual job fair. And we thought that, well, just at the beginning of the pandemic, there would not be much attendance. Yes, the employers actually had, the number of employers had gone down to maybe about 12, 15 employers, but the job seekers surged to over 600. That tells the story of the need for jobs, even though it is at the very beginning and everyone is uncertain about the job market, the safety in the job environment. There is really I think a huge need for employment at that time. The other things that we just finished, as Vanessa had mentioned, we just finished a small business survey that just in the Chinese American community, how small businesses are being impacted by the pandemic and what are the needs for them to sustain and recover from the pandemic. So we search in terms of number of business that had laid off their employees. The respondents of our survey show a 41% of employers that actually had laid off staff. And compared to a national average of about 25.7%, and the New York State average about 34.8%. So our community actually had experienced a bigger job loss than the state and national level. And then we, in the same survey, we also had some other data. And we asked the respondents to let us know how, their success rate in terms of applying for a relief and assistance program like the CARE Act or the state or city programs. The success rate among our community is much lower than the national and state average. And furthermore, when we ask how helpful are those programs to these small businesses, and more than half, 54% of them, say that they're not helpful at all to slightly helpful. And I think we look at that and say, why is it so? Like they apply for the programs, they got the programs, why do they feel that it's not helpful or only is very slightly helpful? And we come to an observation that a lot of the small business, let's say they don't keep proper records. And we're in a community that is really cash-based economy. So if they don't keep proper record, number one, even if they are eligible for those programs, they may not be able to get the full benefits. And I think that's why they really don't, even if they get something, it is really not enough for the true expenses that they need to sustain the business. So I think those things are really showing the impact and the disparity between our community and the national and the state average.
Thank you, Hong. I think this is kind of clearly part of the things around the challenges of navigating even what limited supports have been made available to small businesses, but to communities at large. Now, Dia, you up in the Bronx and working with the South Asian community there, you've had to, as a smaller nonprofit, have pivoted a lot around expanding the types of services and seeing the challenges of a lack of digital literacy in working with your community.
Yeah, I think Annetta touched on it earlier, right? That digital divide that we see, that it marginalizes our communities on the best of days. And then in the middle of a crisis where everything went virtual pretty much overnight, right? You couldn't do anything without getting information on the internet. Even the applications that maybe you could get a paper version, in order to get the paper version, you had to go online and print it out, right? So how is that really that helpful for somebody who doesn't know how to use a computer? So I think what we were seeing is that we ended up needing to help people with so many things. And it was oftentimes things we had never done before. We were there researching just alongside them, being like, okay, there's this new COVID rent relief. What are the implications for our community? Who's eligible? And then people would come with a particular story and we're like, oh, we're not quite sure. Let us find out. So it's been a huge burden on our staff, really, how much work there is. And we're really stretched thin. We get phone calls day and night, weekends. We're a small nonprofit, so it's mostly our personal phones, it's ringing off the hook. And the need is there. And honestly, this was need that was there before. We're not really seeing that many new needs. It's just more of the same needs that were there. And that's what happens when you don't invest in Black and Brown communities.
That's right.
It's not that they didn't have higher health, mortality and morbidity before, right? In the Bronx, the rates of asthma, diabetes, and all those things are much higher than other communities, right? Poverty is higher, housing insecurity, food insecurity is higher. But just the amount of people who are reaching out to us, and they're people from not just our community or our area. We've been getting calls from people kind of situated throughout the 5 boroughs. We've gotten people, we started a food pantry back in March of last year, and I would say about 25% of the families that come are Latinx families in the community who just don't have other places to go. So it's not just the South Asian community that has been kind of approaching us for help with different things. So I think it's also something that when you look at the funding, right, we were able to reach, we were able to get a fair amount of funding for a food pantry pretty quickly, but majority of that funding is to purchase food. So foundations, city, it's often that they're happy to fund purchasing of things. They're happy to donate like thousands of pounds of food, but who is actually going to distribute that food, right? If you don't have somebody to hand out grocery bags, to package the grocery bags, that food's never going to reach the community, to make phone calls, to tell them to come. And the funders often don't want to fund the staff, right? They don't want to fund the rent. They don't want to fund the staff. They don't want to fund capacity building, but they're happy to fund 3,000 pounds of, I don't know, melons, right? So unless you have that capacity in your staff, it's really hard for us to actually do the work and be out there. And I think that's just something we always see, but because of the exacerbated need in our communities right now, it's something that we're seeing even more. And we're helping with like SNAP applications, with COVID rent relief, finding micro grants, helping people make a vaccine appointment, right? There's so many things and everything needs the computer right now. And unless, we're able to kind of help them, these are community members that will never get those services that they need.
Right. And I think, at the end of the day, I think all of us are still trying to address the model minority myth in its own ways, where a lot of our needs, given the data and lack of data, continue to be rendered invisible. And I think sometimes the most marginalized and disenfranchised in our communities, even more so. I just want to turn to Jihye Fisher, who's Executive Director of the Korean American Family Service Center, and particularly doing so much work to support survivors of violence, and what we're seeing more so, their increased need for support.
Hi everybody, Jihye Fisher, the ED at the Korean American Family Service Center. KFSC provides social services to those who are affected by domestic violence, sexual assault, and child abuse. At the height of the pandemic, our frontline staff responded to a 300% increase in calls to our 24-hour hotline, and our caseload increased by 49% compared to a typical month during the pandemic. And I'm sure the people on the panel heard me saying this over and over and over, and I still can't believe that this is a reality at the KFSC. Just to give you a snapshot of the data, in 2020, we received over 4,500 hotline calls, of which 88% were DV, domestic violence, sexual assault, and child abuse related cases. prior to pandemic, typically we will receive between 2,000 and 2,500 hotline calls each year. So it has really increased during this time. The pandemic really forced the families to be together, which resulted in increased incidents of violence and also an increase in the severity of the abuse. Victims who had never called before, they finally reached out because the abuse has reached dangerous points. So during the pandemic, already abusive relationships were under enormous pressure and magnified. And so starting so before I go into other support that these survivors and their children are needing, it's not just the intimate, when people, when I talk about domestic violence or sexual assault, a lot of people think of it as an intimate partner violence, but it's what we've seen during the pandemic is the elder abuse. A lot of the adult children would return their home living with their elder parents because the economic hardship. But so the issues that were hidden before the pandemic were never talked about it because they're forced to be together. Now it's surfaced. And because of the stress and other mental health issues that was increased by being together, it has surfaced. And we've seen a lot of violence, elder abuse during the pandemic. And 90%, over 90% of the cases, the domestic violence related cases, all the adult victims they also, I'm sorry, the child abuse has also increased. Many of our children are trapped in their home because of the remote learning. Therefore, not only they're witnessing the violence, but also they're being the target, the direct target during this time. So our child abuse cases have increased enormously. So the population that we serve, they're immigrant survivors. They have cultural and linguistic challenges. So starting last March, I felt that our office has been like a war zone. I can't tell you how many calls we fielded from desperate clients stuck in a house with their abuser during a global pandemic with no work, trying to manage their kids' remote education, and often without legal status or recourse to unemployment insurance or other public benefits. So KFSC has to pivot really quickly and also provide services that we normally haven't done, like food giving initiative, cash assistance, rent and food subsidies, and PPE distribution to not only our clients, but also other community members as well as our staff.
I mean, I think you all are doing so much more, not just for the community, but holding the things for your staff as well. So before we open it up to Q&A from participants, I know Sudha had one last comment, and we can just give them the time for those who want to ask questions to be prepared. So Sudha?
Yeah, before everybody started thinking of SACS as the food pantry organization, that's only from the past, from 2016, because we wanted to provide culturally palatable food, and that's the reason we started. But some of the things that all my colleagues here spoke about, yes, it is true that we've had to do many things that we weren't doing before. But all of us have been doing case management, right? Like some of the work that for SACS, it sort of was kind of easier because we were already navigators for healthcare and community, like health advocates and NYC Care, connecting undocumented people to healthcare, especially during this time. It is so important to connect them, right? So, and also senior support services, where these things could be done, remotely, right? Like, so we could connect them. Senior support services, I'll tell you one thing. One of our seniors was, we have been counseling them, supportive counseling. We've been holding meetings for them over Zoom and all that. We've taught them how to, that's one of the things that we are doing. One of them, the only connection to the world she had in her isolated world was her cell phone. And it didn't work one day. She was so frantic. She started banging at the window, banging on the door, until a neighbor saw her through the window and came and fixed it. It was something very simple. And I think she said, I feel like I'm not a part of this world anymore. Everything is new and I don't know if I can catch up. So there are people like that. So we do supportive counseling and we hold Bollywood trivia meetings for them, Antakshari with song thing, and sort of make liven it up, right? So like I'm only talking about the culture part, culturally sensitive part of it. And we talk about languages, but the translator that they use, it's no good at all. People, for instance, Dia can tell, understand. There's a woman in the shelter with a 1-year-old baby. She only speaks Sylheti. Sylheti is a dialect in Bangladesh, which the translation isn't good. And the shelter people called us saying that the child is so thin, so small, and underweight, and we don't know what to do, and she's not eating. So we had to, our counselor had to speak to her in Bengali. She does not Sylheti, but still it was possible. And now, we provided clothes and we provided food, all that sort of thing. But the thing is, even the food that is available, for instance, in public schools, or that NYC food, what is that? It is food NYC, like get food NYC. It has things in it. It has non-veg in it. It has, beef or ham or sandwiches. So it's not good for people if they won't eat it. So I think we need to make them understand. We keep talking about languages and cultural sensitivity, but so we keep using those words. It's as though they don't have meaning. Those words have no meaning, but that is the truth, isn't it? That is the truth. Yeah.
Thank you for sharing that, Sudha. And I think as diverse as our communities are in New York City, it is so clear that the critical, culturally relevant or responsive and language accessible services that all of our community organizations are providing right now are so critical. And it is just common across all of what you all are sharing, that everyone here, community organizations, are filling gaps, massive gaps that we're seeing right now in supports to our communities. I want to move into our Q&A part of our teach-in today and welcome some of the questions. I want to elevate some of what folks are saying in the chat, but I want to first just kind of point to Councilmember Peter Koo is here with us and wanted to thank him for his support of our community for many, many years now, and invite him to share a few words.
Hi, everyone. Anita and Vanessa, and I saw Duha there. Hello and welcome to everyone who tuned in to CACF's virtual teaching today. My name is Councilmember Peter Koo. I represent Flushing, Queens. We have all seen that COVID-19 has had a tremendous impact on every community in New York City. But you got an early start on the Asian community. The Asian community here and around the country has felt the negative impacts from the virus, even before it ever reached our shores. We felt the distinct sting of decreased businesses in our local stores. We also have been the constant victims of discrimination and hate crimes. If there's one thing the pandemic has highlighted, it is that Asian communities are indeed marginalized. We may be 15% and growing, but we are in desperate need for resources that match our percentage. Our food pantry lines wrap around the block, and most businesses have reported up to 60% in decreased revenue. This kind of sustained decline in customers is enough to put us out of business. This upcoming budget will be difficult, just like last year. If we are to get what we know we need, what we deserve, we need to come together as advocates for the marginalized and as advocates for our community to let the city know that it is time for the city to provide the resources to match our needs. Thank you all for all nonprofits and organizations coming today. And I heard many of the stories. So I really think we should stand together and we should work together to make sure the city listen to us. Thank you.
Thank you, Councilmember Koo, and thank you for those words, which are so true. We are all fighting this model minority myth, the myth of the model minority. Our communities have drastic needs. I want to elevate one of the comments in the chat was around whether we are receiving pushback as Asian American community organizations, leaders, service providers around the needs of our community. And, want to highlight that, I hope that some of what our speakers have shared today, kind of shed some light on that. But, I wanted to ask the panelists if folks want to speak to that sentiment of the pushback that we've been receiving around our community's needs.
Yeah, I think that, I think I was going to respond to that. I saw the question, so I appreciate the question because I think that this is oftentimes what it is, right? They don't believe us, they don't trust us, and this comes as community people of color, particularly as women. Those things are like embedded in our society and system, and honestly, like all of this, I think and it's part of the lesson, I think, from me and the organization is that we've always known this, that they won't believe us, they don't trust us. And so it is really rooted in anti-Blackness, right? And so, so the work that we do, like, I'm glad we have the space to engage in what it looks like and means like for the Asian community, but a coalition, have been our savior of talking to other Black, brown communities specifically. So I just wanted to say that, that as we're experiencing these things, and as we are saying that they don't believe us and trust us, I know that this comes from a structural system that values white people, right? And so, and that is rooted in anti-Blackness, that is rooted in, and so we've been pivot also to build coalition that are not just like anti-racist, but pro-Black, right? And so part of our organization is to commit to a process of learning around like even abolition work, right, that we're thinking about. And so I just wanted to acknowledge that this, for me, what comes up is a system, a racist system, 400 years of existence in this country that created the model minority, the anti-Asian violence, but that is really, really impacted on Black community particularly. And so that coming to our own table, that we actually need to uplift that as well is really important. And again, not to just only be anti-Black, we also need to be pro-Black in this time.
If I could just add one thing to that also, is I think the issue also with a lot of our communities is that there's not enough data. And one of the things I know that CACF has been pushing is the data disaggregation piece as well. And, when you try to look up Asian Americans or even Korean Americans and mental health issues, for example, like there's just not enough data out there. There hasn't been enough studies done. And, KCS has been working very closely with NYU and Stella and her team for many, many years, as well as SUDA and other partners, because we're trying to see how we can have community-based participatory research in a meaningful way, right? So how can academic institutions partner with community-based organizations like ours to create white papers and data and research that is actually something we can then utilize and then take to city council to say, hey, actually, these are really issues in our community, and here's the data to prove it, right? Because that is something that we, have more of a need for, that we need to do, because we're the ones that have reach into our communities. Our communities trust us, they trust our organizations, we speak their language, we look like them. And so I think we need to, that's something that we definitely need to continue pushing. And I remember sitting in a presentation given by DOHMH and the commissioner, and this was not too long ago. And to be honest, I was surprised because the way that they broke down different chronic diseases throughout New York City, they had a map, and it was broken down by Black, white, Latino, other. And so the Asian community was not actually even separated out from that. And the question I had was, I wonder how this map would look differently if you did separate out some of the Asian communities, and how that would sort of change the different concentrations in where the darker concentrated areas are in the city. So I just found it very interesting that even, as close as a few years ago, that wasn't being done. And so I just wanted to leave it off. I mean, I think that's where we need to keep advocating for that and pushing for that as a community.
Thank you for that, Linda. I want to encourage folks who are here, if you have questions, either raise your hand, we can call on you, write them in the chat. We have an amazing set of panelists.
Folks, I did want to go here because I do want to give our speakers a space to really talk about what are some lessons you've learned from the pandemic that we should, as we move forward, hold on to. What are those lessons, and what do we want our government officials to know and actually really do differently moving forward? And if there's, I'll ask for one from each of you. I know there might be a laundry list of things. But hopefully with all of you, you'll get to all of them, so. No takers?
I'll start because Dia, you want to go?
You can go. You go first. I'll go after you.
I got fired up with my last comment, but I think that to the comment of just like people don't trust us, and people have said this before, and like but really that we are the people who we've been waiting for. Like we know what we need, and so I tell my people, my community that all the time, like your needs are your needs. It doesn't have to fit anyone else's, and so really teaching our people to believe in their own stories and their own experiences. And I tell people all the time, I get a little bit crazy when people want to collect data on me, because I'm like, yeah, I'm like literally the walking data. Like you can, like, this is it, and so it's really challenging to always like tell people your story, because even if you put it on the table, it's not treated with dignity, right? The way that people should be treated. And I just wanted to share a quote that someone said, and I thought about this in all aspects of our work, and particularly around social justice. And I think about that, people always say, white supremacy don't impact them, but it does. Like white supremacy impacts everyone. Black, Indigenous, people of color, Asians are most harmed by it, and white people are the most fooled by it. So I'll leave it with that quote that I've heard from an Indigenous leader. And so that for me is always in mind, that I'm fighting for Asian community in my community, that I'm also fighting for the Black community, Indigenous community as well.
You want to go, Linda? I wanted to add something.
I was going to say Dia wanted to speak.
Oh, Dia? Okay.
And then I want to acknowledge that we do have a question from the audience. So Jeffrey Omura has his hands up. So we'll go to Dia, and then we'll go to Jeffrey, and then we'll go back to you all as speakers. Just that last question about what your big lessons are kind of a closing question anyway. So Dia?
Sure. So, I think part of it is just what I was saying before, is that when you don't invest in communities, these are the results, right? It's not a surprise. You close hospitals, you have overcrowding at Elmhurst Hospital, right? These are the expected results of disinvestment. And I think this pandemic has shown us what we actually are capable of doing, right? Like we were able to get food out through various different programs. We were able to give stimulus checks. We were able to open up hotels for stays, for quarantine for people who were sick, right? So there's a lot of capacity there that when push came to shove, we did it, but that's capacity that was always there and we could have been using, right? To house people who are unhoused, to prevent evictions, to do all those things. And we just have chosen not to do it year after year. So I think this has really shown us that we need to invest in these things because prevention is really the best choice always. And it's the cheapest choice also from a government perspective. So I think it's just in a lot of ways shown us how well we could do things or how we can improve things so that we don't have this problem again.
So Jeffrey or Murat, you can unmute yourself and join and ask your question.
Hey everybody, thank you for this discussion. And I apologize, this is not an easy question I'm about to ask. You all touched on the huge increase in in anti-Asian hate crimes. And just this morning, I noticed that there are some conservative groups who have started seizing on the headlines and talking about how anti-Asian hate crimes are just part of this greater public safety issue that we're dealing with in the city. And I really appreciated what some of you had to say about standing together with Black and Brown communities. Now that the NYPD has this Asian hate crime task force, there are many different opinions on that task force, and I was wondering how you all, what you all thought of it, and is it serving the purpose that it was created for, or is it just another way for to over police our communities?
Who wants to go first? Wayne?
Oh, sure.
I saw
Thank
you
you for the
unmuted.
question. I want to be clear. I think that everybody, every resident, every New Yorker, regardless of your background, not just race and ethnicity, if you're a woman, LGBTQ, disabled, etc., you should live, work, play, worship in a safe neighborhood, dignified way, respectful with everybody else. I think it's important, and I actually think it's good that there's more attention around anti-Asian violence. And I would argue that there has always been anti-Asian violence before we started getting things captured on cell phones and posted on the web or on news. My fear around the language that's been going on and very general recommendations we hear, whether it's from elected officials, some of our allies in the community, conservative groups, is this idea of we need more change, we need to hold perpetrators accountable, we need more accountability. A lot of that language scares me because I remember what we were all saying 9 months ago. We were saying criminal justice reform, don't over police our communities, invest in our communities, let's cut the budget from NYPD and shift it towards social services, because true safety comes from social services and human services, like all of us on this panel. So what I would say is that the NYPD and police and law enforcement, DA's offices play a critical role in promoting restorative justice and transformative justice. And to what Chaya mentioned is, we need to not only have diverse Asian American ethnic groups together at the table of decision makers around how do we address anti-Asian violence, we need other leaders and other communities of color to sit with us and we all work together, because because I don't want to see more people of color incarcerated. I want to see more opportunities for us as Asian Americans, Black and Brown New Yorkers, other BIPOC communities, that we can all be together to have safe streets for everyone. And that if there are perpetrators of violence and others have been victims, that there's true opportunities for us to have restorative justice and that we can come to reconciliation, as opposed to what we have seen over the decades is just continue to lock up communities of color.
Thank you, Wayne. I mean, I've learned a lot in terms of just how we define safety, and we need to move away from safety being defined as the absence of violence or crime, but really the presence of wellness for all of our communities as we work together. So, I think, thank you, Jeffrey, for that question. I want to really be cognizant of time. We were going to wrap up in about 3 minutes. So if folks, I want to just give our speakers last few words, if you can sum up your thoughts in maybe about 20 seconds. What is one thing you want to make sure that, we're calling for and holding our government accountable to moving forward. So we'll do a round robin.
I just want to
Yes,
add,
Stella.
I just want to go quickly, 20 seconds, that I actually think that, to echo what Chaya is saying and what Dia is saying, like, there needs to be money given to the people that are actually doing the work for the Asian American communities, and those are you guys. There needs to be more money allocated in federal relief and city relief for, community-based organizations, faith-based organizations, and Asian Americans need to be at the table. They need to be included when there are lists of minorities that are provided and Asian Americans are not in them. That is like blatant omission. So that's what I think. I think you guys, the CBOs, you guys need more money. You absolutely have the power to you have the trust of the communities, you have the power to do these rapid pivots to provide more services, more food, more everything, more referrals. So that's my major recommendation.
I want to do quick round robin and go down my screen. So Aneta.
Everything Stella just said, I just really want to underscore that we need general operating support. We should not be fighting for our survival when our communities are fighting for their survival. And we need to be able to scale. Like, we all need to grow very quickly. There's a lot of work ahead of all of us, and none of us have been able to stay in our lane of programs and services. We do everything and we are everything for our very diverse communities, even within each of our sub communities.
Hong.
Hi. I think one thing that we learn is throughout this pandemic, one word that I hear a lot is pivot. We talked about how nonprofits pivot our services to respond to community needs. From our angle, we also see that workers as well as small business need to pivot, because the Asian community is very self-contained. Someone had said that you almost can live your entire life without having in touch with outside of your own ethnic community. But with this pandemic, this ecosystem is breaking down. We cannot just rely within the Asian community to be self-sufficient. We have to find jobs outside the community because there's not enough job opportunities here. We have to find new customers from outside of this immediate community, because the current customer base is not going to be able to support our way of operating our small business. I think, and I think we need to help these workers, this small business, to really give them access to reach to a greater opportunities that is beyond this community. And I think, again, then that comes back to the nonprofits, that we are part of the system that have this role to play, is to help the workers, the small business to gain access, so that they can build the capacity, they can build a network, and look for resources outside of the immediate community.
Thank you, Hong. Just going to go to Jihei. I put the stack order in the chat. Thanks, Jihei.
So our AAPI community left without a safety net in the wake of this global pandemic, and it's very obvious. And the essential direct services that all of us, we provide to an already marginalized and vulnerable community are really critical for the survivor of all of us, and will be even more so in the recovery efforts. So the more collaboration, and I think it's really important for us to be at the table to discuss really important issues, and that we're not overlooked.
Thank you. Dia.
I think it's what I've been saying all along, but investment in the well-being and safety in Black and Brown communities. If you don't invest in communities, you have communities that don't function as they really should and deserve to. And I think we need to invest in health, we need to invest in education, in all the different things, and especially the community-based organizations that are on the ground doing the work, right? You create a fact sheet, you create a service, but unless you have someone on the ground to make that kind of reality reach the people it's intended to serve, it's not really useful.
Linda?
Sure. Really quick, emphasizing the point, they say this all the time about research, like, the preventative services drive the costs down for city and state. So that's super important. Invest in our communities and organizations. My ask would be, just see us as true partners in the community that do this work, And on a final note, let's get those indirect rates.
Indirect. Kaya.
Yes to all of that. Yes to investing in us, the people that are on the front line. Yes to investing to Black, women-led, queer-led organization, community-based organization, and no more performative policies. No more.
All right, Wayne.
Since everyone's doing city stuff or much of the city stuff, and just a reminder, we could cut the NYPD budget by $1 billion and actually do it as opposed to putting in a press release and then not doing it. And that $1 billion alone would increase human services budget for the city of New York by 20%. And imagine what we could cover: indirect hazard pay, living wages for our staff, and actually serving folks, and just not going to the same contracted groups. I can't believe I'm saying this as CPC, but to everybody that's here. But at the state level, if this pandemic taught us anything, we need the governor to sign the data disaggregation bill of Asian Americans. If that bill was signed, we would know right now which Asians are being served and affected by the pandemic. And if there's no other reason, pass the New York State Health Act. If we had that go through, things would be better right now too.
Thank you.
And invest in our New York.
Oh, sorry, invest in our New York. Sorry, there is a ways to pay for this. You can raise revenue.
Yes. And last, Sudha.
Hi. Yes to everything that everybody else said, but especially data. We are so invisible, except for prejudice against us, or right. So we are invisible, right? So to make us visible, I think it's very important. The data is important. Advocacy is important. On a lighter note, we are so invisible. How many Indian doctors have you seen in all these television series? Grey's Anatomy, ER, not a single Indian doctor. Everybody has an Indian doctor or Indian dentist and so on. Now that the pandemic is there, how many Indian doctors do you see as experts on television? Every other one is South Asian or Indian doctor, okay? So we need to be visible, not to be on television, but to make sure that our communities get the funding, that we get the funding to make sure that our
Thanks, Sudha. Thank you so much, Sudha. And thank you so much to all the panelists and everyone for joining us today. You know, I just want to elevate something that I heard from all of the panelists today, not only about investments in our communities and community organizations and data and not erasing us, but also take leadership from us. We have knowledge. Our communities hold knowledge. We hold our truths, we hold our histories, and we have knowledge. We know how we heal. We need to be in the leadership circles. We need to be meaningfully included in the dialogue and the discussion and the strategy moving forward for this pandemic and beyond. And so I just want to thank everyone for your voice. I hope that folks were able to take away some learnings around the Asian American communities in New York and how we are not only a monolith. We are not a monolith. We're not a model minority, and we must stand strong together as well as with other communities of color as well to really lift all of those in New York who are most marginalized. So thank you all so much for joining us today, and we look forward to seeing you all in various spaces moving forward. Thank you so much.
Thank you, everybody. Appreciate all your.
Thank you.
Bye.
Thank you. Bye-bye.
Thank you. Take care. Hi, everyone. Thank you all for joining.